even on things like Obamacare, you were out there championing, which he feels has hurt the district.
Well, of course he's going to say that. He's running against me. He's got to find some things to criticize. But, you know, that's just old Washington political talk again. What we need is to hear constructive ideas of what are his ideas to move the state and our country forward rather than just criticizing. You know, and it's that type of blatant criticism that's led to the polarization, the hyper-partisanship that's paralyzed Washington, and even Madison for that matter. And I'm running a positive, issue-oriented campaign, and let's talk about health care. You know, the more needs to be done to reform a health care system that was leaving too many people behind. And I've been a leading voice of changing the way health care is delivered so it is more integrated, coordinated, patient-centered, exactly those models of care that we have back home here in Wisconsin. If we can take that system-wide, we wouldn't be facing the type of health care crisis we have today.
What are your constituents telling you about Obamacare? Because he brings up the point that, look, 5% of people, only 5% weren't covered before Obamacare in that district.
You know, if he believes that there weren't uninsured or underinsured people throughout the congressional district, then he obviously doesn't talk and meet the same folks that I do. You know, just the other day, I met a young woman up in Wisconsin Rapids who told me her story. Ever since she was a little girl, she had a mental illness and therefore a pre-existing condition. That changed with the Affordable Care Act. She was able to go into the state exchange. She found an affordable policy. She's getting the prescription medication she needs. She recently enrolled at UW-Stevens Point to become a nurse because she wants to help others. She said there's no way she could have done that except for the health care bill. And there are numerous stories like that that I'm hearing. So if he thinks, hey, the health care system was fine as it was, he is completely disconnected from what I was hearing too. A small business owner said he got sick last year and didn't go in to get coverage because he didn't have it. And he waited until it became too painful. And then he did have to check himself in. He was discharged a week later with a $68,000 bill. And they told him if he had just come in when he first noticed it, it would have been 2 weeks of oral antibiotics at a cost of $120. That's the difference between him getting coverage this year under the exchange and him not having coverage last year. I'm not here to convince people it was the perfect answer, but we have to learn what's working and what isn't and be willing to make changes and adjustments along the way. And this call to repeal everything and take us back to square one is either dishonest or disingenuous at best.
You obviously are at least supportive of Obamacare right now and going forward, making tweaks to it perhaps, but leaving it in place. Are there things that the president has done or is doing that you're not on board with, that maybe you call questioning?
Well, we need to accelerate the payment reform. I really think that's the key. If we can align the financial incentives the right way and tell healthcare providers, you are going to be paid on the quality or the value of care given and not the volume of services. It's these volume-based payments that have been driving up the cost for families, businesses, and even in our public budgets. So I've been working with our healthcare providers in order to accelerate a value-based reimbursement system so they know that if they're hitting quality benchmarks and quality outcomes, they're going to get rewarded for doing so.